Hello, my name is Ruth Berga from GE Centricity Practice Solutions, and we're here to talk about value-based care. That's our scenario up here, and we're going to take you on the journey of Officer Tim Jones, who's a police officer. We have some of his props over here. He has been complaining of some weight gain, and he hasn't been able to sleep very well. But before we go on his journey, I want to introduce you to Hannah from NetSmart, who's going to talk about value-based care.
Thanks, Ruth. Hello. So we're going to look at Tim's journey in the context of value-based care. So what is value-based care? Value-based care is trying to look at care provisioning in a different way. Instead of looking at each provider, looking at their own segment and treating the reason that the person presented in their office without any knowledge of the person as at large. This used to be under the fee-for-service model that we all know, but it caused a lot of gaps in care. It caused duplication of services, and for the most part, especially with chronic conditions, it did not yield the outcomes that were long-lasting and cost-effective. So value-based care is shifting the focus to the person as at large and not just to the symptoms. So instead of looking at just the presented diagnosis or the presented complaint, we're looking at a whole patient, including things that are not necessarily clinical, like social determinants of health that would impact the overall outcome at the end. And how is that impacting, how is interoperability playing here is because now the care needs to be coordinated. Multiple providers or multiple services that are often presented in the community and in the home need to all be part of the same plan of care. They need to know and be sharing the information about the patient so that that patient who's in the center of the care can be engaged and can be part of their own journey into wellness. So we are going to now continue with Tim's journey.
Thank you very much. So to start Tim's journey, as you might see behind me on the walls, we are kind of suggesting the world that he lives in. And over here on this side, we're in the primary care clinic. So I'm coming over to my Centricity Practice Solutions, and I'm running Centricity Payer Connect. And when I log into that as the primary care provider, I can see some payer insights on the screen. And those remind me that that the insurance company has some information they would like me to see. When I click on those, I can see that Tim has previously had a pre-existing condition of diabetes. So what I'm doing here as a primary care provider, and this is just incorporated into the office visit, is I'm going to affirm that Tim still has this condition, and I'm going to, by doing that, trigger a message that goes back to the insurance company, and that message will include all of the clinical documentation that we gather here in this clinic. So when we do that, the interoperability part is that we're using a CDA document that's generated by triggering, by affirming this condition. That CDA document is a CCDA, it's a progress note, and we're going to use cross-enterprise document sharing to send that to the insurance company. So when the insurance company receives that, they can use that clinical information to evaluate for care bundles that the patient might be eligible for based on his condition. And they can also, of course, increase their reimbursement and do a better job of taking care of the patient. So to continue his journey in the primary care office, I'm going to pass you over to Elizabeth of Alliance of Chicago.
Thank you, Ruth, and good morning. I'm Elizabeth McKnight, the Alliance of Chicago. We're a health center controlled network, and I'm here today with Jeremy Carr and with Jamie Bubb, and we are going to play the role of the healthcare provider for Tim today. So, Jamie?
Hi, good morning. So we're going to carry on the story. We're, again, picking up Tim. He's in the office today to see the provider. So we're acting as the clinical care team. So you'll see on our screens here, this is the Alliance Chicago clinical content. So we're starting to room Tim for his office visit. We're going to enter in his height and his weight. And you'll notice on our clinical content, it will automatically calculate the patient's BMI. That BMI interpretation, I'm then able to, whether I'm the clinical support person or the provider, add that diagnosis to the patient's problem list. Alliance Chicago has also developed this next form, which is used within the clinical workflow to be able to document the occupational data for health. This form was built on the standards provided by the CDC, National Institute for Occupational Safety and Health, and it assists the provider and the care team to be able to collect that data, those social determinants of health that Hannah mentioned, to be able to use along with clinical decision support. This also provides other agencies that you'll hear from in the scenario today with the occupational data for health subsection of the social history in the CCD that is produced related to the visit. You'll also notice on this form the patient's last A1C or lab result value for his diabetes. It was 8.8, so it's a little bit high, triggering the yellow warning that you see on the form to the provider so that they can act on that A1C value. Below the warning is a button that will execute the clinical decision support call to the Qvera interface engine, which generates a fire call to the CQL tool within GE Centricity. This action then compares the data in Tim's chart to the clinical decision support from MITRE, which we'll hear from Chris shortly here. We're also going to then complete some of those recommended referrals for Tim, our patient today. We know that he needs a sleep study, and we also know that he needs a little bit of nutrition counseling. So we're going to fire those off from within the GE Centricity EMR. With the completion of this office visit, it will trigger an XDR transmission of the CCD, which includes those recommended referrals and associated occupation data for health, which is delivered to NetSmart, playing the role of the post-acute provider. So we're now going to hand you over to Chris from MITRE to talk about the actual clinical decision support. Chris.
Hi, my name is Chris Moselle from the MITRE Corporation, and the clinical decision support that we just saw came from CDS Connect. Now, CDS Connect is an online repository for clinical decision support artifacts. It's sponsored by the Agency for Healthcare Research and Quality, and it's developed by MITRE. Now, CDS Connect hosts a number of artifacts that are all derived from evidence-based standards of care, and they're expressed using interoperable data formats like HL7 Clinical Quality Language, or CQL, and HL7 FHIR. Now, all of these artifacts are available for free for anyone to use, and in this story, that's exactly what the clinician did. You see, several months ago, the clinician was exploring CDS Connect with her team, looking for artifacts that might be helpful in their practice. This is when they stumbled upon an artifact called Occupational Factors Impacting Diabetes. Through CDS Connect, they learned that this artifact was stewarded by the National Institute for Occupational Safety and Health, which is an agency of the CDC. They also learned that this artifact looks at the patient's record for those occupational and environmental factors that are known to impact a patient's ability to effectively manage their diabetes. Well, the clinical team really liked the way that this artifact looked, so they worked with their IT department to download the standards-based CQL representation and then to integrate that into their CQL-enabled EMR, in our case, GE Centricity. So as a result, when our friendly officer Tim came into the office this morning, this standards-based CDS found in his record that he worked rotating shifts, and based on that information, it suggested appropriate educational materials to help Tim as he tries to deal with this shift work while having diabetes. So going back to the use case, at the end of the last demonstration, you may recall that Jeremy set off a few recommended referrals. So next, we're going to go to Hannah from NetSmart to see what happens.
Thank you, Chris. So now I'm playing the role of a post-acute care provider. As you know, post-acute care providers are very important in value-based care. They provide wraparound services and direct services at a lower cost of care setting. They monitor outcomes and they prevent the need or the return to higher cost settings, so contributing to the overall value and outcomes. I received a referral from Alliance Chicago, so I'm going to look at the CCD on their referral, which has discrete data elements. Because they're discrete, I can actually run my smart referral intelligence layer, so the system can analyze the data in the CCD and help me make informed decisions on the care that is recommended. So the first thing I'm seeing is that while the referral was for home health services, Tim is not homebound, so he does not qualify. It's good, but he still needs services. So the system is suggesting to enroll Officer Tim in private duty services. What does that mean? I can still provide Tim with services like medication reminders, meal prep, or even exercise planning and support. Looking at the CCD data, the system can then look at diagnosis and conditions, but also lab results. So if you remember, in his visit with Chicago Alliance, the A1C turned out to be high, 8.8. Because it was included on the CCD, I can see the same thing, and I can ensure that the services are provided to mitigate that situation. Also, there is a problem of the day somnolence and sleep apnea, so recommendation of a sleep study. Because we don't provide those services in-house, I'm going to refer those to the recommended affiliated providers in my community. So I'm going to send a referral of the nutritionist services to Academy Nutrition and Dietetics. This referral is going in through Inform in the form of an XDS, and I will refer the sleep study to Eastside Sleep Center. This referral is going out to Epic in the form of an XDR. So now we know that we have provided Tim with the services that he needs in support of his journey to wellness. And I will give the mic to Margaret, our nutritionist.
Thank you, Hannah. And if you'll come with me over here to this screen, I am Margaret Ditloff, and I am a registered dietitian nutritionist, and this is Lindsay Hoggle, and she's also a registered dietitian nutritionist, and we're with the Academy of Nutrition and Dietetics. So our dietitian is using an application that is a nutrition outcomes management system, and it's been enabled with a FHIR API. And we have set up to have an automatic subscription notification whenever a new document is addressed to us. And this is coming to us through the Infor's Cloverleaf engine and FHIR repository. So when we click Add for the patient, we can then automatically retrieve from the FHIR server the patient demographics, as well as his conditions and observations. And we're selectively getting the conditions and observation data that we're interested from the FHIR server. So we can see that this is coming from the original visit in the primary care visit, the Alliance of Chicago recorded. This is an improvement for us in nutrition and dietetics because in today's typical scenario, we would receive only a fax notification. So that fax would be the first entry that we would know that we have the patient, and it comes with very little or no supporting information. So this saves time using the new interoperability standards. We as a dietitian, I don't have to do duplicate data entry, and for Tim, our patient, we don't have to ask him repeated questions that are the same over and over again. So when he comes into the clinic for the visit, I can actually focus on his nutrition problems. And as we can see here, he's got an excess energy intake, and it's related to his challenges around meal planning and his long hours in the patrol car and the shift work that he is doing. So we're going to actually target his nutrition education and skills development as an intervention, teaching him about how he can substitute fresh fruits and vegetables and different meals instead of the fast food and the other items that he's used to eating. I'm also going to teach him about carbohydrate counting so that he has 65 grams of carbohydrate at each one of his meals spread out. That's going to help him with managing his blood sugar levels better. So Tim is motivated. He knows he needs to lose weight to help reduce and get his blood sugar under control. So he's agreed to lose 10 pounds in the next 3 months with additional counseling. And we're going to save that goal, as well as this entire nutrition care plan, back to the FHIR server, where it's going to be available to all of us on this connected care team throughout the community. And in addition to, of course, his primary care physician, who was the referral to us. So at this point, I'm going to take it and introduce you over to Epic, and Ryan's going to take us through the sleep study.
Thank you. Hi, I'm Ryan from Epic, and welcome to the Eastside Sleep Center. I'm the referral coordinator here, so let's take a look at our report. Here we can see that we do have a referral for Tim from NetSmart. It's been automatically associated with Tim's chart with demographic matching. And we do have an attached CDA document that we can take a look at. Now this has a lot of information for us, mainly the reason for referral being that sleep study, so we are in the right place. So as I place on my pulmonologist hat, I'm going to take a look at Tim's chart before he actually comes in for the visit. Now there's not a whole lot of information here for Tim yet. Maybe we haven't seen Tim before. You can see that there's no active problems that we have listed, but there are new problems available from an outside source. So that attached CDA document that came over with the referral, that had discrete data in it, and we were able to parse out some problems. And I can go ahead and add this daytime somnolence to Tim's local chart in our system. So we conduct the sleep study with Tim, and we find that Tim has sleep apnea. So in order to take care of that, I'm going to place an order for a CPAP device. Now I'll talk with Tim about this and kind of finish up my visit. And as I close out my encounter, automatically in the background, that's going to trigger a direct XCR message to be sent over to Brightree, which contains that order and device information. So with that, I'll pass it to Gary.
Thanks, Ryan. I'm Gary Bartlett from Brightree, and I'm playing the role of the post-acute care home medical equipment provider, and we're going to be dispensing and setting up the CPAP device for Officer Tim Jones. So my HME company has been set up to receive electronic referrals from Eastside Sleep Center through the form of a continuity of care document. I'm going to go ahead and refresh the work list here to bring up that new CCD. So you can see we received the CCD, and we're going to go ahead and work that as an electronic referral into our system. So as part of processing the discrete information on the CCD, we can pull all the patient demographics and determine whether or not we're currently servicing that patient within our organization today, or if it's a brand new patient. For any new patient, we will automatically fill the chart with the information from the CCD, and for existing patients, we can go ahead and reconcile the information that comes in on the CCD against our local patient record. This includes demographics as well as clinical information, including diagnosis codes, height and weight, and the ordering physician. In addition, we also have the ability to pull the patient's insurance policy information and store that locally on the Brightree record. Finally, within the plan of treatment section, we have the details about the home medical equipment that's being ordered. As was mentioned, the order was placed for a CPAP device. So in addition to understanding that we have a CPAP device to fulfill for Tim, we also have the answers to some critical Ask It order entry questions that are needed when setting up the CPAP device. That includes the liter flow per minute and the number of hours that Tim is using the device each night. So all of this together allows my HME company to service Tim in a highly efficient and accurate manner and get him the equipment that he needs to improve his condition, which ultimately leads to better outcomes and reduced readmissions. So at this point, I'm going to turn over the mic to Mark from Infor for him where he can describe the role that Infor has been providing behind the scenes in facilitating information exchange.
Thanks, Gary. I'm Mark. This is Praveen. We're with Infor, and Infor has been playing the role of a data integrator. Let's take one step back. Before Officer Tim presented, the Academy had created a subscription with our server and asked us to notify them when we received any document addressed to them. So if I can direct your attention over to the diagram, NetSmart sent us a referral for a nutritionist via an IHE transaction. We deposited the document into our IHE repository and then transformed the document into a series of FHIR resources, which we stored in our FHIR server. Subsequently, the nutritionist was notified. They retrieved the information, performed their assessment, created their care plan, and posted it back to the server. Now, changing roles just a bit to that of a care manager, I can use this lightweight portal, which is available to everyone on the team, to see a consolidated view of the data that has been passing in the background for Officer Tim's case. And with that, I'll pass the mic back to Hannah for the summary.
Thank you, Mark. We hope we were able to see the important role of interoperability in enabling value-based care. We started off with Tim presenting in a primary care setting with a complaint of insomnia and weight gain. But because we were able to connect with the payer data, we were able to surface that Tim had a pre-existing condition of diabetes. That condition completely changed the course of approach to Tim's journey and triggered provision of services, but also of education materials. We were able to use CDS and clinical decision support to inform us and provide Tim with information that would empower him and engage him in his own care. We also looked at things beyond lab results. We looked at social determinants of health. In Tim's case, it was his night shift that prevented him from eating well and maintaining a healthy lifestyle. So the intervention by the nutritionist of engaging Tim and giving him alternate approaches to healthy eating was helping keeping him engaged and own his own journey. We provided him additional services and support in the community between private duty, sleep study, and the CPAP machines to ensure that he can remain safely at home and continue his journey. And all this happened while sharing information across all of our providers and looking at the same data, whether it's the first time that we've seen Tim or if he's already been treated by us. And all this would not happen without the ability to aggregate data and translate between the various protocols. Thank you very much.